On today's episode of 5-Minute Radiography, we're going to be talking about some terminology that always ruffles feathers in our community. Have you ever been called a radiology technician instead of a radiologic technologist? I have, all the time actually. Now, if you don't want to go through the trouble of explaining this every time it happens to you, feel free to send a link to this episode to educate people. But let's break these down. When I was coming up with titles for my book, I knew very well the difference between a technician and a technologist. And while I had briefly considered simply using the abbreviated term tech, thinking strictly of search engine optimization, that even prompted some controversy to the point where someone actually questioned my credentials. There's no better way to get under some radiologic technologist's skin than to call them a technician, whether it be X-ray technician or radiology technician. It's a raw spot for some of us because, at least in the United States, we've struggled as a profession to gain the level of recognition we deserve for our field in many ways. Make no mistake, a radiologic technologist is classified as a healthcare professional, much like a registered nurse is, going through the same amount of school to obtain our registration and supporting licenses and certifications. Okay, so we know that, but do you think we're being overly sensitive to the issue? I personally think it depends on the situation, but let me ask you this. Are you so quick to correct someone or be offended when they call you a radiologist or a doctor? If not, I suggest you evaluate your motives for correcting people. Let's break down the differences between a radiology technician, a radiologic technologist, and a radiologist. But I'd like to also discuss how we as professionals are responding to these labels in case of mistaken identity. Looking at the term technician by itself, the definition I found is a person employed to look after technical equipment or do practical work in a laboratory. I like to think of a computer technician, a job I had in school. A computer or PC technician typically builds, repairs, or troubleshoots problems with computers. A radiology technician could be someone with an electronics degree or a biomedical degree who does not interact with patients, but may be responsible for repairing X-ray equipment. There's also another distinction that can be made regarding the term radiology technician. In some states that require state licensure, like where I am in California, a technician can be distinguished separately from a technologist in that a technician has received some training to perform certain types of X-ray examinations. These are typically limited to chest X-rays and extremity exams, and while they're taught how to perform these, there's typically minimal education regarding radiation physics, which includes a lot of background information on how X-rays work and the danger they can impose on human tissue. In other words, they're taught what to do, but not why, for the most part. There's typically no college degree associated with limited licensure, but there may be a certificate provided upon completion of this kind of training. A radiologic technologist is a healthcare professional who is educated typically at an associate's degree or bachelor's degree level, here in the United States at least. We learn how our equipment works, from the electronic circuitry to quality control testing and QA measures. We learn anatomy and physiology in great detail, how radiation affects living tissue down to the subatomic level, and best practices in technical factor selection and radiation protection. We're also responsible for higher dose exams that not only include the chest and extremity procedures, but fluoroscopic examinations using live X-ray, more complex examinations of the cranium, and we have a foundation for advanced modality training for areas outside of general diagnostic X-ray like CT, interventional radiology, and cardiac cath lab. A radiologist is a medical physician who goes through medical school and spends several more years specializing in the field of radiology. They can interpret the exams that the technologist performs, like X-rays, CT, MRI scans, ultrasound, and mammography. They can also specialize in areas like interventional radiology and treat patients, but they're seen as the highest authority of patient care in a radiology department. So we've defined these. Now let's talk about how we should react when someone calls us, the technologists, a technician or a radiologist. I think there should be a balanced reaction with this. People in the medical field should be able to get this right, but most don't know the difference when they call you a technician. And while that description is not accurate, don't let your ego allow you to react too harshly. especially when you're trying to promote a level of professionalism. Snapping at someone is not going to allow progress towards professional recognition. It's okay to educate people, but with a balanced approach. I tend to find it flattering when someone calls me a radiologist, at least until I remember they don't really know the difference. I typically say, well, the radiologist is a doctor and I'm a technologist who performs the exams that the radiologist reads, without any snappy comeback. I actually heard a technologist tell a patient once, "You need to address me as a technologist, not a technician." I think we can all agree that that kind of response isn't in the best interest of the patient and certainly doesn't promote professionalism. Your average patient doesn't care. I'm going to say that again. Your patients don't care. The point is, if your patient calls you a technician, I would think twice about correcting them. There's a time and place for every conversation and to promote your field. You know it's inaccurate, and there's a really good chance that your patient isn't purposefully calling you a technician to offend you. If I was a patient who may be nervous about the lumbar puncture I'm about to undergo, or if I'm experiencing some pain that just won't go away, the very last thing I want to hear is some hospital employee who's handling my care right now correct my terminology because they have a chip on their shoulder. That's not going to help any of us progress with professional recognition. I'm not saying let it slide 100% of the time here, but check your attitude and have some situational awareness before schooling someone on the difference when you're at work. If you feel compelled to correct someone in the moment, do so kindly and professionally. Professional healthcare workers should be thinking of the patient first, physically and mentally. Feel free to explain the difference outside the scope of patient care at your leisure. We really do need to continue promoting our profession and educating people. Take opportunities when you can to educate, but not at the expense of patient care. I know this episode's going to be controversial, and that's okay, because I want to open up discussion. I would love to hear your opinions on this, and I know there are many. Or if you want to share your experiences having this discussion, I'd love to hear that too. You can find the show on Instagram and Twitter at 5MenRad, and you can subscribe to the show on iTunes or any of your favorite podcatchers. There's also an interactive Facebook group if you'd like to join the discussion there and talk amongst your peers. Feel free to reach out if you'd like to ask questions or suggest a topic for a future episode. Thank you so much for listening, and have a great week.